For the first time in a decade, tuberculosis is on the rise again globally. The setback has erased years of progress towards tackling the curable disease which affects millions of people worldwide. According to the World Health Organization, the resurgence is linked to disruptions in access to healthcare because of the COVID-19 pandemic. TB is the 13th leading cause of death and the second leading infectious killer after COVID-19. The WHO has disclosed the alarming numbers. In 2020, over 9.9 million people fell ill with TB worldwide, and out of those, approximately 1.5 million people died from TB in the same year. Around 4.1 million people with tuberculosis have not been diagnosed or officially declared, up sharply from 2.9 million in 2019.
For the first time in over a decade, WHO is reporting an increase in tuberculosis deaths. Tuberculosis is the world's second top infectious killer after COVID-19, claiming close to 4,100 lives a day. Approximately 1.5 million people died from TB in 2020. Over 9.9 million people fell with TB worldwide in 2020, including more than 5.5 million men, 3.3 million women, and more than 1.1 million children. Among all those affected, 8% were people living with HIV.
WHO Chief Tedros Ghebreyesus said in a statement, "This is alarming news that must serve as a global wake-up call to the urgent need for investments and innovation to close the gaps in diagnosis, treatment and care for the millions of people affected by this ancient but preventable and treatable disease." The COVID-19 pandemic has made the situation worse for people with tuberculosis. Health funds have been redirected towards tackling coronavirus, and people have struggled to access care because of lockdowns. There was also a drop in the number of people seeking preventative treatment. Now, tuberculosis is caused by a bacteria that most often affects the lungs. Like COVID, it is transmitted by air by infected people, for example, by coughing. Most TB cases occur in just 30 countries. Many of them are poorer nations in Africa and Asia. More than half of all new cases are in adult men. Women account for 33% of cases and children 11%. India, Indonesia, the Philippines and China are the main countries that saw a drop in reported cases. The modeling suggests the number of people developing the disease and dying from it could be much higher in 2021 and 2022. The WHO's aim is to reduce deaths from TB by 90% and reduce the incident rate by 80% by 2030. But the latest figures threaten to jeopardize this strategy. Global spending on tuberculosis diagnosis, treatment and prevention also fell from $5.8 billion in 2019 to $5.3 billion in 2020. The 2020 figure was less than half of the global funding target for the disease.